Well, thank you everyone for coming. Welcome. This is Empowering Minds' first info session on Demystifying ABA Therapy. My name is Ophelia. I'm a mother. Like you guys, I have two very special minds, ages 6 and 5. They're currently in the childcare room with all the other kids. And this is my 4th year on this path of figuring out what to do for our kids who have been diagnosed with autism. And I have been where a lot of you are. I have experienced all the stomach kicks when they tell you your child has been diagnosed. I have experienced the extreme thoughts of, is this what life is going to be like? My husband is here. He's helping people get to the door. And it's been a very big learning journey for us, but it's also been an empowering one. Because we have gone through rejection for our kids, them not being able to fit into certain places. We have gotten into, not being able to find the right groups for them to also participate in. Not being able to travel sometimes, not being able to go to restaurants, not being able to do the things that other families can do. But once we figured out, this is a different path to life for us, we decided that we were going to do things different. And ever since we made that decision, a lot of things have changed in a positive for our family. And so I wanted to put together this little brainchild of mine, Empowering Special Minds, to help other parents out there to get more access to resources that could support you. Not just the kids, but also you as well, so you feel empowered throughout this journey for your kids. And so today is our first info session on Demystifying ABA Therapy. With me, I have Erin Bond here, who is the Executive Director for BTLC. That is the school that we are presently in. She has been in this field for 20 years, advocating, working with families, working with children, teaching, and just being very passionate about what the future can be for these kids if they are given an opportunity. That's Erin. And then we have Jessica, who I've been very happy to work with. She is my boys' ABA therapist. She's a behavioral therapist. She's been working since 2014 in the field. Very loving and compassionate, I will tell you. She really cares about the kids and what they can do and the opportunities that they can be offering. And so I'm hoping today that you guys will feel comfortable enough to ask the questions that are most important to you about your kids, about your fears, about the things that trouble you the most, and we're here to answer. We started off with some questions just to set the baseline on what ABA therapy is, what autism really is, to clear a lot of the scary things you may have seen online. Let's clear them all. Let's start with the baseline and build from there. And then there will be an opportunity for everyone to ask questions throughout the presentation. So if you're okay, we can start. That work for everyone?
Please.
Awesome. All right, so I'm going to start with the definition of autism, guys. So the National Autistic Society defines autism spectrum disorder as a lifelong developmental disability. This is something that you're going to be faced with. There's no recovery from. It is forever and ever. But in your field, Erin, I'll start with you. What do you define ASD as?
I often say I don't think I spend much time defining it per se. I kind of leave that to the diagnostic criteria. But what I spend time doing is looking at the children and identifying what their strengths or their challenges are. So in the classroom setting, I'm really looking at what's impacting a child's ability to learn or be included in the type of classroom that parents may want their child to be included in, which is usually, in a typical classroom, in a typical preschool, kindergarten program. I work primarily with the kiddos in their early years. So I'm really focused on looking at what are the functional skills that our kids need so that they can be as independent as possible and they can be learning within a more inclusive environment. So I say to Ophelia, I read the letter of diagnosis, I read it thoroughly, but I end up putting it away in their file and spending more time looking at the children in front of me and sorting out, what do they need to be working on? What is going to help them to be more independent? What is going to help them to learn? In our program, we have a specialized classroom. That's the classroom we're in right now. And then we have children that are integrated within typical kindergarten and preschool classrooms. So my goal within this classroom is that we support the kids to gain the skills that they need so that they can move on in those community settings.
Wonderful. I like that you focus more on looking at the children, analyzing their strengths and weaknesses. How does that play a role in, determining, hey, this child may need more support here and this child may need more support here?
Well, I think it often, it's about where do we want to see them, I guess. So if we're looking at, my goal, if I'm honest, is for our kids all to be included in inclusive settings. So I'm looking at what are those things that are standing in the way of them being able to do that. And it depends on the child. For some kiddos, it might even be simple things like being able to sit in a group activity, being able to face the teacher and listen to what the teachers say. Some of my kiddos that have some more advanced skills, we're maybe looking more at their social skills. Almost all of our children that are in community settings have a goal around how to include themselves in a group of peers that are already playing, which is a really big step to take. It's not even just initiating, it's how do I get myself included with this group of peers. So we definitely want to look at what their strengths are and play those to support them in gaining the skills that are standing in the way of them being able to do the things we'd like them to do.
Awesome. And Jessica, because you work more in community, you work more directly with families in their homes and community settings, what does ASD really mean for you? Like when you see a child and you're like, oh, this child has been diagnosed with autism and we need to get a therapist to work with them. What does that mean for you?
For me, again, I do a similar thing where there is the diagnosis of autism, which means there's challenges with social communication and repetitive behaviors. However, it does really depend on the child. Everything is individualized. The thing about autism is that if the famous quote by Dr. Stephen Shores is that if you know one child with autism, you know one child with autism, because it's so individual when you have the diagnosis. So it's going to look different in every kid. When I go in to work with a family, I'm looking at what the context is, what are the behaviors that they're struggling with, what goals will help the family with meaningful change overall.
Okay, I seem to hear both of you say, understanding the child's needs is important. And I know that when we start, this process of working with kids in the classroom, when we start the process of working with the kids at home and community, we start working on goal setting. How does that even begin? How do we start building goals? What is the best way, I guess, that you guys have seen in your expertise to help parents start building goals for their kids? Because if you put yourself in a parent's shoes, you've gotten this diagnosis that your child is level 1, level 2, level 3 autistic, and you now are trying to build goals. How do you even begin that?
It's really a consultation and conversation with the family on what's going to make the biggest change for them. Where are you struggling? Is it going out in the community? Is it at home during different routines? Is it during dressing and it's so difficult to get dressed, for example, for a child. That's where the individualized piece comes in, and that's where your practitioners that you have in home or at school, they'll be consulting with parents to figure out what those goals are. Practitioners will also do general assessment, so they're making observations, they're talking with the aides, they're talking with the family to try to get a sense of what goals are going to help a child with the best functional development over time.
I would echo the same things from a school standpoint. I think there's lots of conversations with families, but I also think our approach is looking at, like as a team, we're constantly thinking about where our kids are headed. So what kinds of expectations would they have in another classroom, ideally, like I said, in a typical classroom. And so that guides our programming and our goal setting, because that's the environment we want them to be able to move forward into. So we chat, Maddie is my lead EA, so Maddie and I chat frequently about what other kids would be expected to do. So if they're going to be expected to do that, then how are we going to set that up so that we can teach those skills? And sometimes it's, significant skills like communication, participation in the classroom. Sometimes it's small things, like we were just doing an activity before spring break where the children are going in two different directions. So they're called to bring something to one area and then turn around and go back to where they are. And we were talking about, let's teach them how to be able to navigate around each other. Let's not, steer them around. Let's show them that if someone's in their path, they need to step out of the way and move around. So sometimes it seems like the simplest of things, but in a busy classroom, in a busy community setting, those are the kinds of things that our children will be faced with. So let's teach them those skills so they can be successful there.
Awesome. And just to kind of touch on something that both of you have said, it's constant consultation with the families, with the parents, and the service providers that you're working with, be it an SLP, an occupational therapist, whoever. So is there an expectation that the parents or the families have to have these goals already kind of figured out before conversation, or are we saying that these specialized providers are going to work with you to identify the goals?
I think often as parents see progress with kids, they'll start identifying more goals. So I used to work in home programming too. So that's where we would start, is what is making life difficult? What is keeping you up at night? What is making family life difficult? And that's where we would start. And sometimes we would work with families that initially didn't have very many goals. And as they saw that things could change and we might be able to help support development of new skills or reducing behaviors that were maybe really challenging, I was always amazed at how families would come up with more and more goals. Okay, what about this? What about that? So yeah, I think in school as well, we're not necessarily looking for families to direct that, but we want that input. And we want to make sure that what we're working on is significant and meaningful to the child's life, whether that be in the home or the school setting that they're in.
Yes, and families definitely do not have to have all the goals in mind before consulting with a practitioner. You might notice things, but the practitioner will, or teacher in an educational setting, will consult with you, figure out where are the challenges and where are the strengths, so that you can build on those strengths as well as work on the challenges where your child can develop.
Awesome. All right, so now let's start. Let's bring this back now to ABA therapy, because I'm sure some of us have seen something on ABA therapy on the internet. We're not really sure what it is. We've heard some things positive, some things negative. And, in some cases, they're like, this is scientific. We have results. Children grow out or recover from autism. What is ABA therapy?
So ABA therapy is a scientific approach to behavior. So it is looking at skill development, managing problem behavior. So some problem behaviors that are more severe could be self-injury, for example. So we're helping to create meaningful change in reducing that self-injury. It could be physical aggression. So those are some things that pop up. It's creating opportunities for kids to grow and create that meaningful, significant change that might even look like just participating in a group setting or being able to access community settings where there have been challenging behaviors or challenging events that have occurred in the past. So those are some examples.
Okay.
Sorry, question on that. So when you mentioned physical aggression, what do you mean by that?
Like hitting, kicking,
Us
scratching.
or like themselves? Or
The child can engage in that. So oftentimes when you see problem behaviors, it's because there's no ability to communicate wants or needs. It could be dependent on a certain context. So in applied behavior analysis, we're looking at what is the cause or function of the behavior. and there can be multiple different functions.
And I think children can be aggressive towards other people, or they can be aggressive towards themselves. Not all children, but those are sometimes behaviors that we do see.
And it's not, I don't think it's across the entire spectrum of
Not at all.
autism.
No, it's
Not all children diagnosed with autism exhibit problem behavior. And that brings me to my next point. What is behavior? Because we're saying applied behavioral analysis. What do we define behavior as parents?
Well, and I think that's what I was just going to jump on is behavior outside kind of the behaviorist world, I think has this image of always being challenging behavior. Like we talk about behavior as, that child was being quite behavioral today, and so you think negative. But from a behaviorist perspective, so the approach that we're taking, behavior is anything an individual says or does. So it can be what we would maybe term as negative behavior, but it can be positive behavior. So what ABA, the approach is looking at just basic behavior theory. So the idea that if we want to see more of a behavior, we're going to reinforce that behavior. We're going to pay it off. We talk about that in behavioral terms. If there's a behavior that a person is engaging in that we want to see less of, then we need to not pay that off, and we want to try and remove the reinforcements. We don't want to give it attention. We don't want it to be a way to escape a situation, whatever it is. So it's really important. I think I always say when I do workshops with teaching people applied behavior analysis, it's really important to understand that behavior term that we use just means any skill, behavior, anything a child says or does. So we're just going to apply the same sorts of approach or strategies or methodology to improving positive behaviors or developing behaviors that weren't there before, as well as reducing challenging behaviors.
Exactly. So it'll be focused on, again, like reducing those challenging behaviors, but also there's, when you say behavior overall, it's looking at developing those positive behaviors.
And so are we saying that focusing on behavior first is a core benchmark to start working on all the other skill areas that children need development in, or they're struggling with and they need more support? Is it safe to say that?
I think it's usually the place that we start, because I think if we go back to when we're talking to parents about, okay, what do you want to work on? What is most challenging? It usually, for a lot of families, will come back to some of those challenging behaviors. But even kiddos that we have that are not necessarily presenting with, more overt challenging behaviors, maybe they're kiddos that are quieter, their behaviors are more anxiety-based, those kinds of things. It's often the place where we start to identify what skills need to be developed. The best way, I think, to look at challenging behavior, like I said, whether it's that more kind of in your face kind of behavior or if it's more of a subtle behavior, is that it usually exists because there's a skill that's lacking. So that's, like I said, that's how we get to saying, all right, we need to work on these skills. Or it's there, it's a skill or behavior that is there, but it's not naturally reinforced, so it's not inherently reinforced for that child. So they maybe know how to engage in this positive behavior that we want, but it's not very fulfilling for them. So they're not doing it on their own. They need more of that external reinforcement, or we need to support that skill or behavior a little bit more. So I don't think it has to start with, it's not all about behavior, but it's often the place that we maybe start to identify what are the other skills that we want to teach.
Okay, so now looking at where we are in Alberta, there isn't that many ABA therapists. It's not well supported. It's not like play-based. It's not in the schools. It's not in the learning centers. Why is that?
Oh, and affiliate, when you asked me that before, I was saying that, and this dates back to my years of working more with home programming and FSCD, if that's familiar to you, Family Support for Children with Disabilities, is funding that's available to support families in their homes. And I think the discussion that I used to have largely with those professionals is that they don't really want to support ABA because ABA is not a quick fix. It's not, all right, we're here, we're going to teach these skills and we're done. We're constantly identifying what are those meaningful skills that kids need to develop. We're constantly breaking down really complex skills and starting small and building those up. And so I think from a funding agency, and I would say that exists in home programming, it also exists in school, from the educational funding is, if I'm honest, I think that's not, they don't really want to support that level of intensive individualized programming. I've argued for years that they absolutely should, because the results are there and we see kids gain skills and move from, you know, requiring more of a specialized placement to be able to integrate within an inclusive setting. So I would continue to argue, and will continue to argue for all the days to come about it, but that's what I think I've run up against, is that it's not quick. It's intensive, it's individualized, and there's dollars that would be needed to support that.
And Jessica, why would you say it's also not being supported by individuals or families who are looking for options for their kids? Because in some ways, like when I'm on my Facebook family groups, you see people are very anti-ABA. Why do you think that is?
I think that there's a lot of misinformation that goes around about ABA itself. ABA is very focused on compassion, at least in the most recent years. It's very focused on compassion ethics, and it's a newer field as well. So in terms of all the different therapies that are available right now, it's the newest of the field, within the field.
It has most substantial research behind
Yes,
it. So
yes.
I was saying to these ladies that I recently went to a presentation by a well-renowned psychologist who said, quite honestly, ABA's got an image problem, a history problem, and just there's you know, it's evolved from where it was, but there is, like you said, a lot of misconceptions out there about it. My mentor is one of the PhD students that worked with Ivar Lovas, which is the foundational research behind ABA. So it's the Young Autism Project that came out originally in the 70s, was revisited again in late 80s. And like any science, the methods that were used, the language that was used, the goals that were identified from that research have evolved, right? So the challenges that I think exist with us moving forward, still believing and supporting this approach that we know is so highly effective with kids, is just getting past some of that history that's there. But I was saying that, you know, having worked very closely with one of the PhD students, I'm always reminded of the fact that even though there's this lot of controversy around it being a really unfair approach for working with children, it started, the whole premise of it was to take children out of institutions, provide this sort of therapy, and show that they could learn and that they had the capacity to learn. So it has always been about supporting children. It has always been about development and growth and success for kids. Some of the methods,
Yes.
some of the terms, some of the approach that was used, no longer supported anymore, no longer considered to be acceptable anymore. It's out of the practice of ABA. But as I keep saying, it's science. Science evolves. And so our understanding of what we do, you know, 30, 40 years from what we did 30, 40 years before changes in all fields.
And so that's a very good point to make, because it's evolved over time, like every other research, like every other practice. How does it work? How does it differ from play-based therapy or CERTs out there? What makes ABA stand out, Jess?
I think it stands out because it is focused on learning. It is focused on learning for the child, looking at their environment, being able to figure out goals that are going to create that significant change. ABA is also it's evidence-based, and a lot of the times practitioners will also use data collection to focus on which goals are the most important. It differs from play-based a little bit in that sometimes you can use different methods in order to teach a skill. They can look a little more rigid, but again, these techniques have also developed over time as well.
And I think one of the areas that I think I found in my experience was, play-based is very more child-led. It is very much instructor-led. What does that mean?
I think I'm always honest that we're not child-led. We are child-friendly, absolutely. But I joke that if we were child-led, we would have probably a classroom of kids in various corners doing their own thing, right? So we provide the context, that we structure the activities. In our classroom, we're looking at kind of mirroring what a typical preschool kindergarten setting would look like. So we're leading that. And then within that, we're teaching to the goals that we have for the kids. And they have a voice and a say in what we're doing. I always joke that some of the criticism around ABA is that it's very mechanistic, it's very robotic, which, Maddie and I would talk about on a regular basis if we go home exhausted, because there's no way that it's mechanistic and it's robotic, because it's always based on how the child is behaving or participating or responding in front of you. So if they're not showing the skills that we're looking to teach them, we're breaking things down and we're coming at it from a different approach. Or, we spend a lot of time looking at, all right, they're not motivated. All right, we need to go out shopping. We need to get a bunch of new reinforcers. We need to look at things a little bit differently. We need to motivate them to learn. So child-friendly, so focused on how the child is responding to you. But yeah, they're not necessarily leading what we're doing. I'm providing that structure.
The other thing is it's very individualized. So sometimes ABA therapy will look like it's child-led, but it is not necessarily. It depends on the goals that they're focused on. So that's where your practitioner can go between goals and work on them in different ways.
Mm-hmm. And I think one thing that's also important for parents to note is, working with a child-led program versus one that's parent-led or instructor-led does give the parents a lot more control over situations with the children, as you would raise any other child out there. You want to tell them, hey, we're going here, you don't like it, but you're still gonna. And they will respond with, the right behaviors. They may not like it, but they have to comply because that's what happens. And so I guess that's one of the things I wanted to note about that in my experience, is being able to still communicate to my children who may have some behavioral needs that, hey, I get you don't like this, but we're going to do it because we have to do it. And they may throw a little bit of a fuss, but you see them doing it at the end of the day, and it's And so that's one of the benefits, I guess, of introducing and teaching them how to learn that it's okay to fit into situations that you don't choose to fit into.
And everything's broken down. So a key part of an ABA approach is that you're breaking down those situations. So, I often, right now I'm touring families through our program, and I'm often saying, because they're watching a group of kids that are transitioning from having a reinforcer break to sitting down at the carpet and joining back in the activity, and it looks pretty seamless. And a lot of parents will say to us, my child's not ready to do that. That's not. And I'm always saying, oh, we really need to video in September because it does not look like this in September. In September, it looks like we're going to direct you over and you are going to sit on the carpet and you are going to put your bum on that carpet and we are going to make Disneyland come to town, and then you go. And we will practice that 50 times in a day if that's what needs to happen. We set our classroom up so that all of the good stuff is with us. And outside of us is just furniture. And kids learn very quickly that, oh, okay, I'm going to want to come where you are, and I'm going to want to come and sit down where you are, because that's where the good stuff happens. And that's how we teach those skills. So it's never force children to do something that they don't want to do. It's figure out how to motivate them to do something that they might want to do, and how to break it down to really small steps and build up from there.
And so,
sorry.
Yeah.
You give us an example, very simple example, how children could have child-led versus parent-led.
I think child or ABA, I think the focus is really do believe that kids can learn. And so we don't approach it from the standpoint of they don't want to do this, we've got to find something else. We approach it from they don't want to do this, how come? What do we need to do to motivate them to be able to learn this skill? And we're constantly evaluating, like Ophelia's giving you an example with coloring. That may not be the first thing that we tackle. It largely isn't the first thing that we tackle, right? We're going to tackle the stuff that's really going to interfere with them being successful in a classroom or in a home setting or with their family.
How to hold a pen,
Yeah.
how to hold a color, sitting at the table. It starts in gradual bits, but there is positive reinforcement along the way. We're not saying, oh, sit here and do this because you have to. This is the military. No. There's going to be hand-holding along the way, things that makes them feel comfortable, but that skill is paramount. You have to sit there because you're going to be successful for it in the future. You're going to be able to sit in rooms where that's all there is and still be able to carry on. And that brings me to my next question. Is this about teaching children how to learn? Because, we're not just leaning on their strengths, but we can see in ABA that there is capability rather than they aren't able to do this. And so how do we teach children how to learn? Is that what's paramount for you?
Our approach is learning to learn behavior. So that's how I describe, especially our specialized classroom, is we're teaching kids to learn. And that looks like teaching basic skills like just cooperation, sitting, attention, communication, language comprehension, following directions. Like I was saying to you earlier, our classroom in September looks very different than our classroom here in April, where we are working on much more complex activities. We look, I think, as a whole, much more like a typical preschool or kindergarten classroom, but that's because we built the foundation in those early months where, we practiced leaving what you were doing to come over and do something more structured. We practiced extending the amount of time that you would be, you as the child would be willing to sit and participate in this activity. We worked on following basic instructions so that, when we called, we sing in our classroom, hands on top, and that means stop what you're doing and listen to the teacher. There may be a new instruction coming. We have adults all around that are helping children follow that direction. They don't know what it means in the beginning, but we're going to prompt them, we're going to support them, we're going to reinforce them for doing it, and we're going to build those skills. So yes, I constantly talk about learning how to learn.
Okay. Let me go into how this is beneficial for parents now. So now we've talked about what ABA therapy is, how it works. But there are other skill areas that need to be built, like communication, some fine motor, gross motor. How does ABA support all these other interdisciplinary skill areas, Jessica? Especially in the home environment. What is the relationship there?
So behavior and looking at behavior in general helps with all of the different skill areas in a multidisciplinary team. So when I say multidisciplinary team, you might have a speech language pathologist, you might have an occupational therapist, you might have a physiotherapist. So those are some different ones. Your doctor is actually technically a part of that as well. If you think about it, yes, dietitian. Yeah, so those are, when you think about a multidisciplinary team, it's how are all of these people helping your child. Behavior is often the foundation of starting to learn how to learn, and how can we help support the child in developing those skills further. So for me, when I'm working within a multidisciplinary team, I'm consulting with the SLP, I'm consulting with the OT, I'm consulting with physio, so that the child has strategies, the child and the other practitioner too has strategies to support the kiddo. And with their consultations too, they give me observations that they've seen, and we work together as a team, so which is amazing.
And Erin, in the classroom as well, because once the classroom is over, the children go home and then they come back the next day. How has that worked for you, understanding the bigger picture of what else is being supporting kids?
I think our focus is on addressing all areas, and Jessica is saying, I think so I don't have a SLP and OT, a PT on team with me. I coordinate with families that are accessing those services within their home, or if I'm feeling like we need those services brought in, then we will add that consultation to what we're doing. But I think the big thing for me, I think, is for people to get beyond seeing ABA as just working on behavior, and then there's the speech path working on speech, and there's the physio working on gross motor, and there's the OT working on fine motor. That's not the way it has to be. We don't need to work in those silos. We work best when we all work together and collaboratively. We work best if we have families that are accessing home programming, that we're working with those professionals to meet those kiddos' needs. So I think, doing this for almost 3 decades now, my big focus is to get us to maybe kind of pull back our professional terms around us and just work together collaboratively to address a child's needs. I was thinking back to your example of the child learning how to color. It would be things like, all right, so it's not just sit down and color, but it's connect with the OT to find out, what coloring implements would be more successful for that child. Where in their environment would they be more successful to color? Talking with the SLP about teaching children to be able to ask for help or request the things that they want. It all works together. I think when I'm working alongside professionals, my issues will always be that it's going to be the timing of things too. I was just recently working with OT with a child that was really struggling at that moment, really not wanting to engage he's in kindergarten working on coloring and drawing and things like that. And all of a sudden, in the middle of him really struggling, the OT wanted to stop and give him a hand massage. And my ABA background isn't going to go with that, because at that moment, we're possibly going to reinforce this child really struggling and really resisting engaging in this activity. So I said, hang on, not right yet. Right? Let's get him working through this. Let's get things calmer, and let's do it by actually engaging in the activity. So we engaged the activity, we slowed it down, we're reinforcing his moments of cooperation. And then when he's settled, we can go ahead and give the hand massage. And if we decide that the hand massage would help to regulate him, it would help for him to feel calmer, then let's figure out the timing of that so it doesn't end up paying off or reinforcing challenging behavior. It's used to promote more positive behavior. So my best friend professionally is an OT, and historically OT and ABA, they struggle to get along, but we often say we need to walk the world saying you absolutely can. It just comes down to the timing and when your strategies are implemented.
The most successful teams that I've worked with have that collaboration. They have team meetings, they have ISP meetings where everybody's contributing. So those are definitely important to collaborate within your team. Yes.
Okay. And so now I guess the $1 million question. What can we give to all the parents here, all the parents who are going to watch this video, who are listening in, that's going to help them feel like they can support their kids better?
I think a really important thing for parents is to remember that you are an advocate as well for your kid. So you are able to speak up to your caseworker, you're able to talk to your clinicians about what you need. So that's where the consultations with your practitioners are important, but also to your caseworker when you talk with them.
Yeah. I think my answer is always that kids can learn.
And that too.
Right? Is knowing and trusting that your kids can learn the skills that you want them to learn, and finding the right people, I guess, to support that learning and development, finding those people that feel comfortable and confident adjusting their strategies, looking at it from a different angle and figuring it out. So I joke with our team that once you understand the foundations of what we do, then you're kind of maybe overconfident and maybe slightly arrogant about things at times, that I can teach this, I can do this. But I love the confidence behind being able to say we can make this happen.
I'm gonna go differently in the sense that from a parent's perspective, it's a bit more real that you are faced with this diagnosis for the child. And unfortunately, our healthcare system is not the most compassionate in delivering this diagnosis to you, saying, yeah, your child is autistic, you're going to have to support them their entire life. I remember when I went for mine, my first, I came back to my husband, who's there, and he can tell you, I probably didn't sleep for the first month. I plowed everywhere on the internet to understand what that meant. And it was the most demoralizing thing that I have ever been told. And over time, in working with different people, in reading different literature, I realized that my child is different, but so is every other child out there. No two children are the same. Just because there is a medical term that now defines to them what my child has or what he's facing or the challenges he's going through does not make him different from every other child. And that became so evident when I walked into a Walmart and what is termed as a normal child is screaming on the floor, lying down, saying no, they don't want to do it, and is kicking and throwing a fit. But my child does it and they say, oh, your child's autistic. Makes sense. What do you call that one? My child's not kicking and screaming on the floor, but yours is. Our children are different and they're special. And when you have that as your mindset, things are going to be different. It means that the way this child learns is very different from the way your child is going to learn. I see that in other children in other schools. They have different accommodations. But because there is a term, we're told that there's something wrong. All that means is that your children are different. And so I would urge every parent to embrace the difference. Embrace it. Don't run away from it. Don't try to put them in a box. They have their own light. Let them shine in their own way. I joke about it with my husband and my mom. My brother was perfectly normal, but he failed every class in high school. My other brother, who had a developmental challenge, worked so hard and got average grades, but he had to work 10 times harder because he had a developmental challenge. What does that say? A normal kid fails what they term as normal. So embrace it, don't run away from it, and find the right support groups that will empower you. That's what this is for. It's to connect people together, connect you to the right teams that will empower you, connect you to the right resources that will empower you. Because your children have their strengths. Don't put them in the box that the society wants you to. Thank you guys so much for all your